My name is Nathan Knight, and I am a RN BSN family nurse practitioner student at Auburn University, and I will be performing my head-to-toe exam for my advanced physical assessment class. This is my patient, Madeline. For the purpose of the exam, she has chosen to remain fully clothed, but in a professional setting, during the head-to-toe evaluation, the patient would be undressed. So we will start my head-to-toe exam. First, we're going to start by looking at the general appearance of the patient. Overall appearance, patient looks professionally dressed. There's no foul odors noted. She is a well taken care of adult female. And we'll move on to the patient's head. We're looking at general appearance of the patient's head. Patient's head is round, symmetric. We're also looking at the patient's hair, noticing any abnormalities. And then we'll go ahead and just inspect the patient's hair. We're going to look for patient's hair and look for any parasites or any lumps or lesions, any breaks in the skin, any dry patches or anything noted, and we'll also palpate the patient's skull. And we're also looking for any lumps and any lesions in there as well. The hair distribution is normal. There's no breaks or no bald spots noted in the hair. So everything looks good in there. We're going to move on to the face and move on to the sinuses. And first, we're going to just palpate the sinuses. We're going to palpate the frontal sinuses and the maxillary sinuses. And we will see if there's any pain in those. We'll go ahead and percuss. And there's no pain in there. We'll move on to the patient's mouth, and we're just going to palpate her TMJ at this time. Go ahead and open your mouth, close it. And there's no clicking or popping or pain when you're palpating the TMJ. And we're going to move on to the patient's nose. We're looking at the nose just to make sure it's symmetric, and it is symmetric. There's no abnormalities. We're looking to go ahead and look inside the nasal mucosa. Patient's mucosa is moist, pink, intact. Septum is midline, and there's no abnormalities in there as well. And both nares are clear. We'll go ahead and check the turbinates of the nares. I'll start by just closing one. Blow out. Good. I'll go for the other one. Blow out. Good. Both nares are patent. We'll go ahead and look at the patient's mouth. We're looking at the patient's lips and the color and texture of the lips. There's no cracking. Pink mucosa is noted. And we'll go ahead and open your mouth for me. Stick your tongue out. Go ahead and lift your tongue to the top. Good. Up to the bottom, to the side. Good. And the patient's mouth is pink and moist. Front of the tongue is moist. There's no cracking. Also, the top of the roof of the mouth and the floor of the mouth are intact. Patient had good dentition. There's no cavities, cracked teeth, or anything of that nature as well. We'll go ahead and move over to the eyes. Go ahead and look straight ahead at me. And we're just looking at the alignment of the eyes and the face. And the alignment is good there. Go ahead and cover one eye for me. Alright, cover the other eye. Good. Cover, uncover test. There's no nystagmus or anything noted in that. We'll go ahead and look in the internal parts of the eye. Go ahead and look at her right eye using my right eye. Look straight ahead. And we're looking for the red and right light reflex, the fundus and macula intact. And red light reflex is intact as well. And we would do this on both sides. Alright, everything's intact that way, on that eye as well. And we would go ahead and move on and look at the patient's eyes and the outer express of the eyes. Patient's conjunctiva are normal. pink and moist, no redness noted. Lacrimal ducts are intact. There's no excessive tearing or dryness noted as well. Going to move on to assess the patient's ears. We're going to look at the external aspects of the ear, palpate the auricles on both sides. Patient's ears are intact. There's no dryness or cracking noted. No abnormality, no bleeding. Then we'll go ahead and look at the internal organs of the eye with the otoscope here. We're going to pull the auricle up and back. And just looking on the inside of the ear, there's no cerumen. Ear canal is patent and intact. Tympanic membrane is pearly gray. Go ahead and do the other side. And all bony landmarks are visible at that time. No cerumen noted in that ear, and the tympanic membrane is pearly gray as well. We'll go ahead and move on to the hearing part of the patient's ears here. We're going to just check for lateralization with the tuning fork. I'll tap my hand on the tuning fork, and that'll vibration. I'll put it on the top of your head. Just make sure if you let me know if you're hearing in both ears. All right. And then we're going to check the bone conduction test. We're going to do put this on the back of your ear in the mastoid process, and then you tell me when you stop hearing the vibrations, and then I'll move it over to your other. We'll move it over your ear. All right, and that's the Weber and Rhine test, and that is normal. The air conduction is greater than bone conduction on that test there. Next, we move on to check some cranial nerves, which we checked some earlier. Visual acuity exam was done prior to her entering the room, so that'd be cranial nerve 2. And we'll go ahead and check cranial nerve 1, 3, 4, 5, and 6, and we'll go ahead and do that here. We're going to check the olfactory cranial nerve. We'll just have her smell something here. Just close your eyes for me. That's something in your head. Just tell me what you smell right underneath your nose. Alright, we're going to go on the other side. Okay. Alright, then that's cranial nerve 1, olfactory. We'll go ahead and check cranial nerve 2, which was done prior to the exam, which is the visual acuity exam. That was done before entering the room, and then we'll check the cranial nerve 3. We'll check her pupils, make sure they're equal, reactive, they accommodate the light. And both pupils are equal, round, reactive, and they do have light accommodation. We'll go ahead and check for extraocular movements, cranial nerve 3, 4, and 6. Close one of your eyes for me. Alright, just want her to check the extraocular movement as well. Just follow this for me. And extraocular movements are intact. We'll go ahead and move to cranial nerve number 5, and we did check that with when we checked the palpated the TMJ. Go ahead and close your mouth and clench your teeth real tight. Good. That's cranial nerve number 5, and we'll go ahead and check cranial nerve number 8, which is the auditory cranial nerve, and we'll check that by using the whisper test. I'm going to say something, whisper it on this side, just tell me what you hear, and I'm going to do the same thing on this side, okay? Good. Alright, that was good. That's cranial nerve number 8. We'll go ahead and I would check cranial nerve 9 and 10. I do not have a tongue blade here currently at the house, but that would check the uvula, and we can do that. And we would also check gag reflexes as well. Stick your tongue out. Yeah. Yeah, uvula is midline. We would check gag reflex during that time as well. We'll check cranial nerve number 7. Just close your eyes real tight. Good. Open your eyes real big. Good. And I'm going to close your eyes and try to open them real tight. Good. And that's cranial nerve number 7. And go ahead and smile real big for me. Good. Cranial number 7 is intact. And we'll go ahead and check cranial nerve number 12. And this is the tongue movement, glossopharyngeal. Go ahead and stick your tongue out. Move it side to side. And that's cranial nerve number 12. We've been checking cranial nerves 5, 7, 10, and 12, which is voice and articulation throughout the exam. But I'll go ahead and ask her to repeat something for me, okay? Just repeat these words I'm going to say, and it's you can't teach an old dog new tricks.
You can't teach an old dog new tricks.
All right, good. And that would be cranial nerve 5, 7, 10, and 12. Go ahead and move on to the assessment. We're going to check the patient's neck. All right, go ahead and move your head. Try to touch your chin to your neck. Good, and then tilt your head back. Good. Let's just check flexion and extension of the neck, and then go ahead and move your neck to this side. Good, and good. And that's a rotation, a lateral rotation as well. We'll move on to the neck, and we'll go ahead and just looking at the throat here and the tonsils. Trachea is midline. I'll go ahead and palpate the patient's lymph nodes. We're going to palpate the occipital lymph nodes, the auricle lymph nodes, preauricle lymph nodes, tonsillar lymph nodes, submandible, submental, and supraclavicular. And we're just looking for any inflammation of the lymph nodes, any abnormal nodularities, and everything that was normal at that time. At this time, we can go ahead and check for jugular vein distension. And we'll go ahead and auscultate the carotid arteries here. And we'll check the thyroid as well. So we'll stand behind the patient here and check your thyroid. Swallow. Good. And palpate the thyroid. Swallow. Good. We're just palpating the thyroid and looking for any nodules or any abnormalities. And there's thyroid is smooth, non-tender, and easily palpated. Go ahead and try to lay back for me. And we're just going to check the bed here. Normally the bed would be at a 30-degree angle here. Just looking at for any jugular vein distension. Bilateral jugulars here. Everything looks good on the right. And we would check the left as well. And I'll go ahead and auscultate the carotid arteries using the bell of my stethoscope. All right. There's no rushing sound, no bruise, no thrills palpated. You can go ahead and sit up for me. This one we're just going to move on to the thorax. We're looking at the thorax generally. We're looking for equal chest rise and fall, patient's respiratory rate, and the depth as well as those rates as well. And everything's symmetric. Chest rise and fall is there. Equal respirations are normal. There's no abnormalities noted. Patient does not complain of any shortness of breath or chest pain at this time. Go ahead and palpate the anterior portion of the thorax. Just checking for any crackling, which would indicate subcutaneous air or any pain. We'll go ahead and move on to the posterior thorax. Any pain? Then we're going to go and check for symmetrical expansion. I'm going to do this by placing my hand here at the 10th intercostal space. I'm just going to ask you to take a deep breath. Deep breath. One more. Good. And symmetrical expansion noted. There's no abnormalities in that. We're going to check for tactile fremitus. When I place my hands on the back of your back of your back here, and just say 99 for me, okay?
99, 99, 99, 99.
Good. And tactile firmitus is equal and noted in bilaterally there. We'll go ahead and listen to breath sounds. Deep breath. Good. Breath sounds are equal bilaterally using the Z method, and also starting with the apices down to the bases there. Go ahead and move to the anterior portion of the thorax. Just looking at the thorax here, we can go ahead and palpate for the apical pulse. And then we'll go ahead and auscultate lung sounds on the anterior thorax as well. Deep breath. And breath sounds are equal and clear bilaterally. There's no adventitious breath sounds noted. We'll move on to listen to heart sounds as well at this time. Just breathe normal. Start with the aortic. Go to pulmonic. And then the Erb's point. Tricuspid. And mitral. Alright. Heart sounds are normal. S1 and S2 noted. There's no gallop or any tachycardia or palpitations or any abnormal heart sounds noted here. Go ahead and move on to the abdomen. Go ahead and lay down for me. We're just going to start by inspecting the abdomen, just making sure that is round, symmetric. There's no distension noted. Patient does not complain of any abdominal pain at this time. Then we can go ahead and auscultate bowel sounds. We're going to auscultate bowel sounds in all 4 quadrants. Bowel sounds are present in all 4 quadrants. We'll go ahead and move on to the palpation portion. Sorry. We're starting with light palpation. And noticing for any grimacing on the patient here on her face, and notice that would just tell me if there's any pain, rebound tenderness, or anything like that. We can move on to deep palpation. And then we can also try to palpate the patient's spleen and liver. You start by trying to palpate the patient's spleen on the left side of their abdomen. And then we move on to the liver to the right side of the abdomen, using the sternal border here to help with the liver is not palpated and spleen is not palpable as well, and that'd be normal findings. Go ahead and sit up for me. During the abdomen, also we can look for the aortic and palpate the aortic as well. and we could also auscultate the aorta as well during that assessment. We can go ahead and move on to the extremities musculoskeletal portion. There's looking at the general overall appearance of the patient. Go ahead and check for shoulder mobility and shoulder strength. Go ahead and pick your shoulders up for me. Good. Lift this arm up, move it out to the side. Bring it over across your body. Good. Where that's for abduction and abduction, put it behind your back. Good. All right. And then let's roll it around. Good. And we would do that bilaterally on the upper extremities as well. And it looks like shoulder motion is intact and there's no abnormalities noted there. We'll go ahead and check the strength of the upper extremities. Squeeze my hand for me. Good. Pull against me. Good. Push down. Good. That's just strength, grading the strength of the upper extremities. It's 5 out of 5 bilaterally. We go ahead and move on to the lower extremities on the legs here. You can lay back for me. And we're just checking the legs here and the muscle strength. You can push up. Good. Push up. And we're checking the flexion and extension of the hips and the knees as well. Put your knee up to your chest. Good. All right. I'm going to bend your knee. Rotate it up. Yeah. Good. And across your body. Good. All right. Lift it up. Flexion and extension of the hips are good. And lower extremities, muscle strength 5 out of 5. We go ahead and check the sensation of our extremities. We're going to go ahead and look at the capillary refill of the skin and also check for the pulses of our extremities. Okay. Looking at the skin, general appearance of the skin is noted, and we've been looking at the skin the entire exam. I'm going to check capillary refill here on our fingers. Fingers and nails are intact. No cracking, abnormalities, no clubbing noted. Capillary refill is less than 3, and we would do that on our lower extremities as well. We're going to go ahead and check the sensation over. I'm going to put something on you, and you just let me know if it's sharp or dull. I want you to close your eyes for me, okay? This is going to be dull, and this is going to be sharp, okay? All right, starting there, down to head to toes, okay?
Dull. Sharp. Sharp. Dull. Sharp. Dull. Sharp. Dull.
Good. Sensation is intact in upper and lower extremities as well. We'll go ahead and have her sit up for me, stand up. We're going to check the spine and turn around. Normally the patient would be unclothed, but for the purpose of the exam, patient remains clothed. We're checking the general alignment of the spine here. We're looking for any curvatures, abnormal curvatures of the spine, such as scoliosis, lordosis, kyphosis. Go ahead and bend over for me. Good. And everything's symmetrical and intact there. None of those abnormalities were noted there, and the extension of her back is also good as well. Tilt your head, lean back, and tilt forward. Good. You can sit down. Arms and skin and muscle mass is intact. Capillary refill is good. Sensation is good. We'll go ahead and check stereogenesis here. And I'm going to place something in your hand. You just tell me what you feel or what it is, okay? Close your eyes for me.
Going.
Good. Next one.
Hair pin.
Good. And I just checked stereogenesis as well. We'll move on to the patient's reflexes. We're going to check the reflexes here. Check the tricep reflex. Just relax. Alright, intact. And we'll check the bicep reflex. We're going to do that bilaterally on the upper and lower extremities. We'll go ahead and check the patellar reflex. What's your leg saying? Good. And we check that on the other leg as well. And then we would check the Achilles. And we would check Vivenzi's reflex as well. And all those are intact. Alright. We would go ahead and palpate the pulses at this time. Checking for any abnormalities. We go ahead and check the brachial pulse and radial pulse. We check those bilaterally on upper extremities. We can check the femoral pulse as well. And she would be laying down. Popliteal pulse. Posterior tibial. Dorsalis pedis and pedal pulse as well. And we move on to the Romberg test. And go ahead and stand up for me. Romberg test, we're going to ask her to close her eyes, stand straight up, and to see if there's any swaying noted. Close your eyes. Scoot up for me. Good. Close your eyes. And everything's normal at this time. Go ahead and stand. Move back for me. And just walk towards me. We're checking the patient's gait. Walk towards me. Good. And go ahead and go back that way. And then turn back around and walk towards me, heel to toe. Face me, heel to toe. Good. Now walk back. And now walk towards me on your tippy toes. Alright, good. You have a seat. That concludes my head to toe assessment. You may notice that we have a baby monitor in the room, but we are having to monitor the baby as well. But hopefully that wasn't a distraction too much. But thank you for watching my video.